TVNPA's Tri-Valley Anti-Poverty Collaboration, State of Housing for Vulnerable Populations in the Tri-Valley. We're glad you are all here for this important conversation. That said, I'd like to start by recognizing some of our special guests. First off, our great showing up Mayor, Livermore Mayor John Marchand. Thank you for being here. We also have Livermore City Council members Bob Carling and Ben Barrientos. We have Pleasanton Council members Julie Testa and Valerie Arkin. Livermore School Board Trustee Christy Wayne. And then from Congressman Eric Swalwell's office, Outreach Manager Ron Payne, right here in the front. I'm not sure she's here yet, I haven't met her, but from Rebecca Bauer-Kayan's office, Alyssa Horitke. From the city manager for the city of Livermore, we have Mariana Marshova. And then we have from Alameda County Supervisor David Hubbard's office, Gloria Gregory. And then I'll give a second shout out to Valerie Arkin from Alameda County Nate Miley's office. We really appreciate your support for being here. We know this conversation doesn't mean nearly as much unless we have government officials in the room, so we really appreciate you being here. It's all of us coming together that are going to work to solve the challenges that we're facing today. Speaking of support, I'd like to recognize Sandia Labs for their generous support of our community program. So thank you, Sandia. Also, I'd like to recognize TVNPA's Board of Directors, staff, and the volunteers who've worked to help put this program together. So thank you, everybody. And then when you came in, you were handed a program which included an index card, paperclip in it. If you have a question, please write it on the index card, and we will collect them at 11:30. We're hoping this will streamline the question process. Fingers are crossed that this works. If it doesn't, we'll figure it out really quick, I'm sure. So let me just go through these slides and see. Oh, there's Sandia. And then here are our speakers. We're going to introduce them in just a second, but I want to let you see who's going to be on our panel because we don't have their faces on the programs that you have, so I want you to recognize who they are when they're up here. So we have Tri-Valley Haven, we have Open Heart Kitchen, City Serve, Goodness Village, Sunflower Hill, and Interfaith Housing, and we're really grateful to have all these local nonprofits here representing Lanning, Susan, Kim, Christine, John, and Sharon. I'm going to start by introducing our first two speakers. We're first going to hear from Michelle Starratt, the Deputy Director of Alameda County Community Development Agency. Michelle has 30 years of career experience in housing and community development in progressively responsible leadership roles. She has led large-scale initiatives that enhance community programs and address public needs successfully, raising funds for housing and special needs programs through research, grant writing, and program development. She ensures successful deployment of local, state, and federal funds to maximize funds and deliver results to those in need. Following Michelle, we will have Jonathan Russell. Jonathan Russell serves as the Director of the Alameda County Office of Homeless Care and Coordination. As a seasoned systems strategist and former nonprofit executive, he brings a wealth of experience to his role. Before his appointment in March 2024, so he's relatively new in this role, Jonathan was Chief Strategy and Impact Officer at Bay Area Community Services. In this capacity, he is responsible for steering strategic direction, program design, and new business and fund development. His role also encompassed managing government and external relations, real estate development, data analysis, evaluations, community engagement, advocacy, and policy. Jonathan's extensive experience includes leading direct service teams and large-scale program operations on Skid Row, Los Angeles, and overseeing a diverse portfolio of program operations from homelessness prevention to affordable housing throughout the Bay Area. Following Jonathan, we will then invite our esteemed local nonprofit leaders to the stage for the panel portion of this program. Again, here they are. So now it's my pleasure to introduce Michelle to get us kicked off.
Thank you all so much for having me. Michelle Starratt. I'm the Director of the Housing and Community Development Department of Alameda County, and we run programs that are county-wide programs, and we run programs that are just in the unincorporated county, and a lot of our focus are on vulnerable populations because our department was created, and I'll just share a little tidbit, 50 years ago this month, specifically to serve low-income communities through the Federal Community Development Block Grant Program. And I just want to say one other thing, which is the last time I was in this theater was watching one of my best friends as she was up here on stage performing. So it's kind of fun to be on the other side. I've never been up here and never seen behind the stage, so kind of fun. Okay, we're going to talk a little bit today about the housing crisis that we're in. And I really want to just start off by saying this is not unique to the Tri-Valley. It's not unique to Alameda County. We are in a nationwide housing crisis right now. And for those of you who are not sort of, it is a very personal thing, where you live, your home, where your kids are gonna live, where your neighbors live, that's very personal. And sometimes it's hard to see outside of what's going on in your own neighborhood. But in reality, since about 2014, housing prices have gone steadily up over the last 10 years. And they've gone up so fast, they have exceeded the price that houses and rental units were topped out at before the foreclosure crisis. So you all know that we had a steep incline from 2001 to 2007. That was really generated in California by the dot-com boom and the internet and all of the wealth that was generated there. But then right around 2007, we had our foreclosure crisis, and that was a nationwide crisis also. But it hit us fairly hard here in the Bay Area. Prices plummeted, and from 2007 to 2014, you know, we saw things come down by half. So, well, a third. So $600,000 was the median price in 2007, and it got down to about $400,000 as the median price in 2011. And then we saw prices start to recover, and by 2014 we've exceeded $600,000, and now we're at $1.2 million. That is the median home price in Alameda County, $1.2 million. So we're going to talk a little bit about that. But that crisis is happening across the entire United States. So I really love this report. It is published annually. It's a nationwide report, so I'm talking a little bit about the nationwide crisis. But here in California, in order to afford a 2-bedroom apartment at fair market rent, it costs $42 an hour. You have to earn $42 an hour, either as a single individual or as a dual income household. $42 an hour. This is called Out of Reach. You can Google it, Out of Reach report. The National Low-Income Housing Coalition publishes it once a year, and you can dive deep into not just the state of California, but all the way down into Alameda County statistics. You can also look at Tennessee if you really want. But across the United States, they do this analysis that basically tells us our minimum wage is $15.50 an hour. Our average renter wage is $33, and the 2-bedroom housing wage is $42 in the state of California. In Alameda County, it's $47. So in Alameda County, if you want to afford a 2-bedroom apartment, you need $47. That means that a minimum wage worker has to work 109 hours a week to afford that. That's more than 2.7 full-time jobs. And then, if you wanted to look at a 1-bedroom apartment, it's 88 hours, and it's 2.2 full-time jobs. So that's the 2-bedroom on the left and the 1-bedroom on the right. I think it's great to be able to track things. So the Out of Reach report goes back 15 years, so you can see year over year over year the increase. But I use that as an example to sort of tell us where we're at and what the reality of the situation is on the ground for people who are struggling to find a place to live and struggling to pay their rent. So last fall, after all of the cities had completed their housing elements, who here knows what a housing element is? Most of you, that's wonderful. State of California requires that every locality in the state, every 7 years, write a plan for their housing needs. And the state of California also assigns us a percentage of the growth that the state expects to grow by. And for the last 40 years, California has done nothing but grow, and the population has done nothing but increase. And we have not kept pace building as much housing as we need to accommodate that growth. So the state is now dictating to us, this is how much growth you need to have. So after every city in the county had finished its housing element, the county did a county-wide housing needs assessment. And so here's some of the statistics. Over the last 20 years, the county grew by 230,000 people. Cities grew between 9 and 15%. Dublin way overshot that. So did Emeryville. But they significantly grew beyond that 9 to 15%. I think Dublin almost doubled in size. And Emeryville grew by almost 100%, 88%, something like that. But some of the other findings. Obviously, new housing construction has fallen short of the needs. We haven't kept pace. Housing prices have exceeded income increases, and renter households are at risk. So this shows you where some of that growth is. You can see Dublin, very dark, because it grew by 138%, and Emeryville grew by 85%. Most cities, though, grew by 9 to 15%. Sunol actually dropped in population. It's the only place in the county that did. But that 230,000 people, you know, if you assume that you have 2.3 people per house, that means that we needed to have built 100,000 units, right? My math isn't great. What else did we learn? We learned that population growth was going through the roof over at the far end over here at 140% of AMI, meaning the folks who are earning above median. We grew in that area more than the Bay Area as a whole, and more than California. So Alameda County had a really fast uptick in higher income households. But then over here on the right, wait a minute, that's the right, this is the left. Over here on the left, we also see that we grew in extremely low income populations. So our populations where we see our most vulnerable, that increased, not as much as the Bay Area as a whole or California as a whole, but we still see that as a significant growth, almost 4%. So what did that mean in the middle? We actually lost middle income. And if you have any amount of money, you have a little bit more mobility than you do if you're extremely low income, which means that you picked up and you left Alameda County. So we see a migration out of the county into, you know, Stockton and Modesto and some of the less expensive housing markets for our middle class populations and for our just at the top of the low income populations. So when we talk about housing needs and the RHNA, the housing needs assessment, the regional housing needs allocation numbers, we break it down into two different ways. One is who is here right now, and we have 69,000 households in Alameda County who are paying more than 30% of their income in rent, and about 30,000 of them are paying more than 50% of their income in rent. And that's a statistical benchmark. If someone is paying more than half of their income in rent, they are at risk of homelessness. They are just one paycheck away from losing their housing. They're their car breaks down, they have a health care cost, and they don't have health insurance, or they can't pay for their medication, and that choice between putting food on the table and paying their rent becomes that very difficult decision that they're trying to make. And we know that the revolving door of homelessness is made up of those folks who are paying more than 50% of their income in rent. The future need, and what the state of California told us, is that we're going to grow and we need to build 28,000 new housing units across the entire county for a new population that's not here yet. Now, whether or not that population shows up, we don't know, but that's what the state has told us we need to build. But right now, what we're concerned about is that 69,000 and the 30,000 of them that are at risk of homelessness every time something bad happens. So if we talk a little bit about the regional housing needs assessment and supply and demand, I think it's important to note that we have built units in the last 20 years. We have been building housing units, but what housing units have we built? We have a shortfall of 20,000 units over the last 20 years at the 50% or below area median income level. We have a shortfall at 80% of 13,000 units countywide, and at 120%, we have a shortfall of 23,000. Those are the numbers that the state told us to build, and that's what we did not build. Now, all of that housing, 120%, well, 80% or below, really requires subsidy. It requires some amount of local government resources to come to the table to help subsidize, because the market cannot perform at that level. You cannot expect that the cost of construction can write down the cost enough so that you can actually rent to a household at 50% or even 80% of area median income. That's not necessarily true for 120%. 120%, that's basically market rate. That's normal people who are making above median income, but we did not build for that population. Who we built for, and we built more than what we needed to, was for 120% or above. And we outperformed what the state told us to build by 23,000 units. 26,000 units. What does that number say? I don't have my glasses on, everybody. So we overbuilt luxury housing over the last 20 years. And that means that what we are looking to build for are people who are not at the extremely low or the very low income population, which requires government subsidy, but we also didn't build for our 120%, which is just plain vanilla sticks and bricks, you know, first-time home buyer type units. We didn't build those either. So here in the Tri-Valley, this is a new slide for me, but these are the numbers for the Tri-Valley, Pleasanton, Livermore, and Dublin. And this is, you know, a significantly larger number this time than in previous years. So you can see that across the board, everybody's getting more, but the Tri-Valley also got more across the board with this new regional housing allocation. So let's talk a little bit about what happened. I said this a little bit at the beginning, and I wish I could actually walk around. I wonder if there's a, okay, yay, all right. So this is in 2000. The average purchase price in 2000 was $384,000 here in Alameda County. And what you needed to earn was $85,000 to afford that $385,000 mortgage. Now, that's because interest rates in that moment, so this is tied to what actual interest rates were. But the average income in 2000 was $64,000. So there's a difference of almost $20,000 of what the average income earner was earning and what it would take for them to buy a home. So even though $384,000 seems so low, doesn't that seem low right now? It seems so low. Most of the population couldn't afford it, and we had this gap. This red is the gap. Now we keep going up. By 2005, the average price was probably closer to $450,000. You needed $98,000 a year to afford that, but what people were earning was $75,000. By 2006, at the top of the market, 2006, 2007, the average price was $632,000. People were still earning $75,000, and what you needed to afford that was $131,000 based on interest rates at the time. Now we see the foreclosure crisis. We see the dramatic drop. In 2010 and in 2012, this is when, in Alameda County, it was actually affordable for the average person earning an average wage to afford the average price of home. It took the foreclosure crisis to make Bay Area houses affordable to most people. And so you can see that we're right there. You needed to earn $85,000, and most of us were earning $81,000, and you needed to earn $84,000, and most of us were earning $80,000, the average. But then by 2013, we see this dramatic increase in the prices. And now we're here where the average purchase price is $1.2 million, and you need to earn $237,000, and that is frankly before the interest rates just went up. So we haven't recalculated this since the interest rates went up. And the average income is $129,000, so it's half of what you need to earn in order to buy homes. So what does this mean for your kids? What does it mean for your brothers and your sisters and the people that you know? It means most of us can't afford to live here anymore. And the only people who are actually buying homes are coming here from Silicon Valley or San Francisco, and they're coming into our county because it's more affordable than Santa Clara County or San Francisco County. But let's talk a little bit about rents and what did rents do during the same period of time over the last 20 years. What we see here is that in 2000, we're talking $921 for an average price of a rental, and now we're at $2,200, almost $2,300. And nowhere do you see a significant drop in rental prices. Isn't that interesting? The foreclosure crisis happened, the price of real estate goes down for several years. We're not just talking a 6-month blip, we're talking about 4 or 5 years when the real estate prices really came down. And it took almost 5.5 years, 6 years for it to recover. At no point did our rental prices drop. And I think that's really critical for people to understand that the renter side of the equation never had any kind of relief. So who can afford to rent? And this sort of gets us into, looking at what are general, incomes of different types of job classes. So home health care workers, healthcare support staff, part-time workers are earning $25,000 to $35,000 a year. Food service workers, housekeepers, office admin, they're earning $35,000 to $50,000 a year. Tax preparers, truck drivers, mechanics, roofers, postal workers, paramedics are earning $50,000 to $75,000 a year. You get into your real estate agents and your surgical technicians and your physical therapists and your librarian and your social worker, they're $75,000 to $100,000 a year. Those are all people we need in our community in order for our community to work, correct? Like, we're not going to survive without our healthcare workers or our teachers or our paramedics. We need those people in our community. These are our neighbors who help our entire society move forward. And they make a significant percentage of the population of our county. So let's look at homelessness now. So again, homelessness is really an economic crisis. It's those households who are paying more than 50% of their income in rent, who have some kind of economic hardship that comes at them, and they are suddenly unable to make rent, and they become evicted. So we can see here what rents were over the last, we started in like 2004, so it didn't start as far back as 2000, but 819 is the average rent starting there, and you can, for a studio apartment, not a 1-bedroom or a 2-bedroom, but a studio apartment, And you can see that the housing prices for those studios have done nothing but go up. And then you can see how much income somebody on SSI is earning. And so this is a fixed income, a disability income, a senior citizen income, and you can see the green represents the portion of income, of rent that somebody on that income level can afford. And then the bar is, or the line graph is the homeless count over time. And you can see the significant increase. As rents go up, you can see the significant increase in our homeless populations. So what is homeless housing? It's really paying the difference between what is available for rent, which is about $275 a month, and what it costs to rent a studio or a one-bedroom apartment, which is a gap of between $750 and $1,300 a month. Now, what usually pays that gap, $750 to $1,300? That's your project-based voucher. That's your Section 8 Housing Authority voucher, which has not increased significantly over time. So our housing authorities have always played the role of helping our most vulnerable cover their rent in market rate housing out in the community. And as our population of vulnerable people have increased, our resources to our housing authorities have not. And so they're still getting the exact same amount of money as they were getting basically in 2000. If you look at inflation, it hasn't increased significantly. So homelessness, we need additional resources, and Jonathan will come up here and talk a little bit about this. This is one of my favorite slides from our Home Together plan, which is our plan to end homelessness. And what this is basically saying is that without an increase in homeless funding and without an increase in subsidy to keep people in those homes, where the difference between an SSI income and the actual cost of renting, if we can't increase that, I'm getting to the end of my time here, so I've got 5 minutes. Okay. If we can't increase that, homelessness is going to continue to increase. And it will take a significant new investment, the green line, to actually end it. And can we end it? Yes, we can, with money. It's a money issue. The federal government is the source. We pay taxes. Every single one of us pay taxes. And every federal program is funded by our tax dollars. And every senator and congresswoman who is out there is making decisions about how to spend our tax dollars. And the way the housing crisis has occurred is because our housing department has not received, our federal housing department, HUD, has not received a substantial increase in revenue in the last 40 years. So, without an increase in revenue from the federal government to spend on housing, we're not going to see a relief to this program unless locally we make decisions to spend our own money that way. So there is a proposal to put a regional housing bond on the ballot in 2024. It's coming from the MTC and the Bay Area Housing Finance Agency. They're looking at $10 to $20 billion to put on the ballot. It'll cost between $100 to $200 a year based on what your assessed value is for your single-family home. Commercial real estate will also pay part of the tax. What we would see coming into Alameda County is a significant amount of money. At $10 billion, you can see that Oakland would receive its own allocation, and we would see the county about $1 billion, $984 million, if it was a $10 billion bond. Every county in the 9-county Bay Area would receive funding. So Santa Clara would receive funding, San Francisco, Marin, Sonoma, Napa. One of the things that people talk about when they talk about building new affordable housing, and I'm happy to answer questions on that, but I've only got 5 minutes, so I'm trying to go fast now, is the cost of construction. And construction continues to go up. I want to just say that The cost of construction primarily is labor. That means we're paying people to do things. That means people are earning a wage. So if we want to try and cut housing costs, we're really looking at, well, okay, then the trade-off there is you're not paying the going rate for construction workers. So there are ways to try and reduce the cost of affordable housing, and we're working on that too. But for most part, I think it's important for us to recognize that the cost of construction has gone through the roof in the last, 10 years. Production, that's 52% of that regional housing bond. It really means new apartment construction. Preservation really means acquiring older apartment complexes and making them affordable and rehabbing them and making sure that they are long-term affordable. Protections is no longer something that we're funding. Flexible funding is really going to be first-time home buyer type programs and homeownership programs. And last, I just want to say that we are in the process of taking people's comments. Please look at this website. It's called AC Housing Needs AC. And we are asking for folks to take a survey and tell us what your highest housing needs are in your community. What housing problems are you as a family facing, your neighbors facing, your city facing, and give us the feedback, because that will inform the priorities for how we would do an expenditure plan for that bond if it passes. Okay, so far what we've heard is sheltering unhoused people is the highest priority. I'm not going to spend a lot of time on these. We have been out in the community doing meetings like this, taking feedback, talking to the community to hear about the housing needs. And these are some of the things that we have heard from. I'm happy to share these slides. And then if you would, please do go to the website and take our survey, please. Thank you.
All right. Hello, everyone. This is such a nice theater. My name's Jonathan. I'm new to Alameda County in terms of working for the government, but not in terms of being a long-term service provider and resident. I live in Emeryville, one of that grew 85. Maybe I was 0.001% of that growth at some point. And so I'm of course talking here more specifically focusing on homelessness and housing. It's a little bit confusing. We just rebranded as I also became the director. So we used to be called the Office of Homeless Care and Coordination in the Healthcare Services Agency, which is super snappy and easy to say. So we rebranded the Healthcare Services Agency to Alameda County Health, and our office to Housing and Homelessness Services. In close coordination with Housing and Community Development, we work to really support the services and operating funding and coordination of care for folks that are experiencing homelessness. And homelessness, as you've heard very clearly from Michelle's, it shouldn't take a lot of description for us to understand this, because the word is in the word, but homelessness is about homes and housing and people having dignified places to live. So we like to foreground that by putting housing everywhere we can included in our name. So as Michelle mentioned, we went through a process as a community to develop what we call the Home Together Community Plan. That plan kicked off in 2021, and hence 2026 being the 5-year timeline. And there were really 4 large priority areas included in that plan. And so I wanted to start by providing some big picture perspective that I think dovetails very well with what Michelle was sharing in terms of the need for services and support investment to fund the units and the suite of services we need to end homelessness in Alameda County. So there were 4 priority areas: preventing homelessness for our residents. This is a huge area, which I'll come back to at the end, that is a growing priority for needs and really part of what we're going to be focusing on in the next year. So I look forward to partnering with many people in this room specifically on that initiative. Obviously, also the second priority being to connect people to shelter and needed resources, increase housing solutions, and these are in no particular order in terms of priority, just all of great importance. Increase housing solutions, and then strengthen coordination, communication, and capacity of our system, which will become clear how pressing that need is here. So here's the needs analysis to complement the housing inventory analysis. To drastically reduce homelessness, so this is going back to the graph that Michelle had here. This is just represented in a different way. And racial inequities, which it should be pointed out, part of our processes in developing that plan was really centering, not just because we need to and it's important and people say it now, but because race is fundamental to what homelessness is as a system. And so by ending systemic and structural racism, we end homelessness in the most holistic way we need to. So that is core to our plan, and in order to really address homelessness, which is to say address those structural inequities that most prominently impact those that are Black, Indigenous, and people of color, we need to add just an easy 24,000 units to our system that can support people with extremely low to no incomes. I say that sarcastically because it's a big number, but it's the real number, and it's what it's going to take. And so one of the things that I really appreciated, I was a CBO participant at this time in the community planning process for Home Together, was we wanted the real facts and we wanted to identify the needs so that we could frame this problem for what it is, right? I think very often in presentations like this, and I'm going off script, but I hope it's relevant to you all, you know, we often think about homelessness as a crisis, right? As a FEMA-like emergency, because we see the sort of crisis-like conditions, and that's true, right? But homelessness as such, right, is an issue for us as a community, right? As a moral problem in our society, is much more about infrastructure. But that's harder to see and have before our minds, right? So I like to think of my example is not that our transit systems are a perfect example of good and well-organized infrastructure, but I like to put a big, messy picture of a freeway interchange up here and say, can you imagine this system working without enduring funding that you know is going to be there in 2 years, right? And complex coordination of those services. Well, our freeways and transit systems would look pretty Mad Maxian, wouldn't they, right? We wouldn't know, it would be cobbled together from community to community. Well, homelessness is a social infrastructure problem. And the lack of funding and the lack of the way we structure those enduring funding is what has contributed to a broken and fragmented and often very Mad Maxian feeling system of care. So just to say that, that is really what's baked in here, is we're talking about developing a system and community supports and infrastructure that could really end this problem in our community. I always like to say that up front. So imagine the freeways and imagine that we need to create that kind of infrastructure for our community members. So the estimated total operating cost of that inventory, so to do all this, to ramp up this inventory over 5 years, is $2.5 billion. I hasten to add, if that number doesn't shock you enough, that does not include the capital costs to develop a lot of the new physical infrastructure. This is operating costs, this is rental subsidies, this is services costs, this is all the surrounding supports, but the sticks and bricks itself. And that would ramp up to, in year 5, about a annual operating cost of about $731 million. And that's not where the plan ends, that's the new operating cost, right? To sort of maintain and end this problem in our communities. And for context, this is roughly the budget of our behavioral health department right now in Alameda County. $740, $50 million a year. As I said, it doesn't include the capital costs. A quick survey of kind of the overall, what that would go towards over that period. You see $430 million towards additional shelter. $100 billion for permanent supportive housing, which is, as I'm sure many of these folks will know, that is affordable housing with, deeply affordable housing with supportive services included for folks that have complex needs. $814 million for dedicated affordable housing. I'd like to say dedicated deeply affordable housing, and shallow subsidies. These are different interventions that provide deeply subsidized housing for folks that might not have as complex behavioral needs, which is another caveat I like to say. Homelessness is a housing problem. Not everyone who is homeless has severe and persistent mental illness and or complex substance use disorder. It's really a subset, though we often collapse those into one group, but there is a wide range of folks, those less vivid pictures of folks that are working for our school districts and working in all the service industries that Michelle just described and living in their cars quietly in our neighborhoods, are also homeless and make up a large percentage of our population. So we acknowledge that diversity and who's experiencing that, and the fact that we need dedicated affordability for folks for whom homelessness is just or primarily, which is the case for everyone, usually at some point in their life when they enter homelessness, an economic problem. And things like shallower subsidies for folks that might not need the intensive services is a huge need in our community too. So these would be enduring resources to support people exiting homelessness quickly, right? Because it's an economic issue, and preventing falling into homelessness because they're in economic dire straits. And then $196 million for rapid rehousing. Which, for those that don't know, is a model of service that includes time-limited rental assistance, often titrating down as folks stabilize in housing and can resolve and manage their housing economically on their own, based on increasing wage or other career pathway work. So that's a subset of the interventions we use to support people. So all this together would need to net out to almost 4,200 additional supportive housing units. 3,190 new supportive housing units specifically for older adults or folks with medical fragilities or complex needs. 10,000 new dedicated, deeply affordable or shallow subsidy slots. Or no, sorry, that's just dedicated, affordable, or subsidies. Shallow subsidies, about 5,200 of those, and 1,645 additional rapid rehousing slots. We are completing the report for our second year of the plan, which is fiscal year 22-23, so the last one that ended in June 2023. And so we'll have a much more detailed report with all kinds of fun appendices and graphs and on our website soon. But here's a quick high-level summary of what has taken place in year 1 and 2. Well, in year 1, there was we were nearly on track, actually, with the initial investments. So the investments in terms of increasing these resources, we were nearly on track in those investments across these different target areas, primarily based on a lot of the infusion of the pandemic-related one-time funding that was used towards increasing these supports. So that's really exciting. Wow, year 1, we're ramping up the investments like we said we needed to. Those investments are ending, so year 2, is a very different picture. A lot of that growth has been stalled because those investments have ended. But from an outcomes perspective, because usually you can imagine this much like building a building service structure, right? You do that for a year, you see the impacts in the following out years, right? So we this year are seeing the great impacts of those initial investments in year 1, but we have not had the continued investments that we will very likely see some stalling of the impacts and those increasing impacts in future years, this year or next year, because we didn't have the same increased investment last year. So our system capacity expanded greatly. This is why coordination and capacity building is a huge focus for us. This past year, nearly 25,000 people in Alameda County were served through the homelessness response system. That's a year-over-year growth between years 1 and 2 combined of 34% increase in those served. 25% increase in year 1, which was 21-22, and a 14% additional increase in 22-23. We have really ramped up the permanent housing placements, which is exciting, as you'll see on this graph that I go to bed and wake up thinking about every morning. This is a representation of the inflow and outflow of our homelessness response system. So we saw over 1,000 more placements last year than in year 1 of the plan into permanent housing. So that's something we celebrate and we're excited about. More than 1,000 more people in that year 2 gained housing than in year 1, and that was over 4,000 people total. But we still have a gap from folks who are falling into homelessness. This top line here, the blue line, you see we have a big gap in fiscal year 21-22 where 4,043 people fell into homelessness according to our homelessness response system data. I also want to add that not everyone that experiences homelessness touches our homelessness response system, right? There's a lot of people who experience it more invisibly and don't touch our system. But to the best of our estimates based on who we have data on, This is, and we had 2,900 people exit homelessness. Last year, we were just about within 350 of meeting the inflow. So we had 4,084 people exit homelessness and 4,443 enter. So this is the problem, right? Because of the economic precarities and pressures in people's lives, because of all of the things that Michelle discussed, we have people that are falling into homelessness at a higher rate than even a very well-performing for the dollars we get system can respond, right? This is an infrastructure problem. This is an investment problem. What we need, of course, is increased homelessness prevention, so we need to take that blue line and bend it down, and we need to, of course, rapidly expand the housing inventory to get that orange line up so that we can cross that line, right? And again, that doesn't just, when those meet, that doesn't just fix the problem, because there's actually 18,000 other people that are just in the system experiencing homelessness at one time or another during the year that are not being just in this inflow-outflow category. Here's a quick summary of where kind of our takeaways from an investment place. And I won't go into super detail here, but some other things I really want to highlight because there is good news in all of this, and I think it's important to lift up. One of the primary focuses of the Home Together plan was to reduce the drastic racial disparities in who experiences homelessness in our communities, as I said earlier. So we have seen some real, based on the targeted investments and real focus on centering system design around equity, we've seen reductions in racial disparities in returns to homelessness. This was one of the areas where folks that were exited from homelessness and returning, that's where we saw significant disproportionalities in Black or African American folks primarily, returning to homelessness after having been housed out of the system at higher rates. Right? And if we know anything about the way structural racism works, it is those larger societal factors in folks' lives beyond just our response systems of care that are pressures on people to fall into homelessness. So we saw some reductions in that disproportionality in what we call homelessness recidivism or returning to homelessness, which is great. But overall, the great disparities of percentage of the total population versus folks in the homelessness response system, there's huge disparities that continue to exist. Another really important thing that I like to say in rooms like this so that we can all advocate together is that for all the great work and investments, and you can see here on this kind of fancy graph, 40% of all of our funding for key programs is non-recurring. So one-time funding that we have for a couple of years that we put to use on building the freeways and roadways and things we need to create the infrastructure for the homelessness response system, and we don't know if we'll have it for the rest of the road next year, right? So this is the kind of structural problem that we deal with those lack of enduring resources. So it's a little bit better than in year one, where it was about 50% was non-recurring, but that's only because we had those big COVID response funds. So while it's a little bit less non-recurring funding, meaning one time now percentage-wise, that's just because our overall funding has reduced. You can see the majority, or more than half rather, of our funding comes from the state. State programs like the Homelessness Housing Assistance Program at about $179 million. 60% of that, though, is one time, so this is not recurring, getting it every year funding. 72 million of our funding is local funding, so county or below, city level funding and otherwise, and then about 98 million is federal. And you can see these proportions of how much is recurring and non-recurring there in each case. Okay, I know we wanted to talk about some vulnerable populations, and I promise I'm going to zero in after this on some of what the Tri-Valley data we have on folks served here, because as a still case manager drawn up into administration, I like to talk about the work and the people and how can we focus on folks in our community, so we're going to get there. But I wanted to spotlight something that is really important that I know affects this community as well in terms of who experiences, well, it's homelessness, but I like to call it housing deprivation. Older adults, right? There's been a lot of study, obviously locally here, statewide across the nation, on the growing crisis of older adult homelessness and the steady increase in the proportion of the population experiencing homelessness. That is older adults. There was recently a statewide study produced by a certain good friend of the county, a supporter of much of our work, who's done a lot of evaluations in our community, Margaret Cushell at UCSF Benioff Homelessness and Housing Initiative. The largest statewide study on homelessness since the 1990s. I encourage you to look it up. I think if you Google something like that, you'll find it. It's rich and deep and includes a lot of wonderful direct feedback from folks experiencing homelessness, not just data reviews. 48% of the single adults experiencing homelessness were 50 or older in that study across the state, almost half. 41% of those became homeless for the first time after the age of 50. So this wasn't a serial perennial issue in their life. They were housed, they were living. After 50, they entered the homelessness response system. In Alameda County, good news, older adults are housed each year above the countywide average. So you can see on this graph here, our countywide average across populations for folks that are served and actually exit to positive destinations, right? This includes interventions like just street outreach, right? Which doesn't often translate into permanent housing, sometimes it does. So our countywide average for all served is just under 25%. So it's great that we do have, because of resources and prioritization of vulnerabilities, we have a higher rate of the percentage of older adults moving into permanent housing, 27, almost 28%, but we also have a higher return rate. So similarly to the racial disparities, we have about 21% is the rate of falling back into homelessness within 2 years of being housed. So this is over a 2-year extended period, are falling back into homelessness at a higher rate, right? Versus our countywide average, which is now 15%. Again, there's obvious reasons for that, right? Folks that are on, often older adults, often with disabling conditions, very often not entering the market, right, the workforce in the same way or if at all. And so the need for those enduring supports, right, the need for the medical supports and access. And I will say the need for housing environments where physical health care is accessible on site, which is a huge need in our system that we don't always have. These are some of the factors why, for all the good news of housing more folks that are older adults, we're seeing a higher rate of returns. So one of our priorities was to say we need to do better system-wide homelessness prevention. So this was kind of a top-line goal of the original plan, but we've just now spent a year going through a process with the stakeholders. We met 8 times over 2023 with a wide range of people using national research, key informant interviews, local government and nonprofit leaders. I was one of those at the time. And input from folks with lived experience on what is it going to take to develop a coordinated homelessness prevention system to stop this inflow across our county. So over those 8 meetings, we love the very cool name Homelessness Prevention Strategy Team. We love our acronyms. We called it the HPST. We really identified and developed a pretty robust report that we're getting feedback on what it's going to take in Alameda County. And here's my summary of it. We need a targeted, equity-centered, low-barrier model integrated with mainstream providers and broad community stakeholders that can rapidly engage and support people not falling into homelessness. The good news is we have programs that have been piloting this that have gotten national recognition in our very own communities. The Keep Oakland House program that's been operating for 5 years really piloted a displacement and prevention model that's specifically equity-focused and trying to stop the inflow in Oakland. AC Housing Secure was a program that grew rapidly and massively during the pandemic, providing millions in rental assistance, hundreds of millions in rental assistance to vulnerable households across the county. So we know what it takes, right? We just need to do it. So some of I won't go into the details behind this, but some of the estimates is it'll take about $10 million to reduce the rate of the returns across the county from 16% to 9%. So just focusing on those folks that exit our system and fall back in, if we want to reduce it that much, that's going to be the cost. And it'll take about $43 million to lead to a reduction of those falling into homelessness by 1,070 people. Infrastructure, of course, we need to create a hub, we need to create a system, we need a shared data process and streamlining the access to those services and all that good stuff. But, so here's my Tri-Valley snapshot. This is my last slide. I think I'm on time. Obviously, many of you know this because you track it closely. We are in the process of finalizing, I hesitate to say this because people I know are going to come up to me because I don't have the actual figures and I'm not sharing it yet. The 2024 point in time count is almost done, so that data is coming in and will be shared to HUD shortly and then to our communities very shortly after. So that will be another sort of comparison. We're looking at 2022 data for the PIT stuff. So obviously here's the Tri-Valley curve of growth. Don't feel bad. This is, as many of Michelle's graphs showed, this tracks right along there with the sort of cost of living and the unlivability of our economy changes for folks that are extremely low income. But those numbers in 2022 have hovered around 343 people. Again, counted through that one point in time doesn't always capture the full experience of folks. About 80% of those folks are unsheltered. So it's kind of an 80-20 split here, which is slightly higher, at least in 2022 it was, slightly higher than the county-wide average. It's about 25-75 between sheltered to unsheltered. Demographics, these are some interesting things. I'm just pulling out the things that I identified that show some uniqueness to the Tri-Valley area that really is something to think more about and talk more about, and many of you know much better than I. But about 56% of those in the point in time count identified as female, which is almost 20% higher than the countywide average, where that number is closer to 37%. So there's a higher proportion of folks, at least in the point in time count, that identified as female. 25% were 55 or older. That's right in line with the county average and some of the data we shared earlier of just a growing older adult population. 11% were 60 or older. The top cause of homelessness, so this is a self-reported statistic for the people that are surveyed here in the Tri-Valley, was family or domestic violence. That is different than the rest of the county in terms of the top of the plurality of options, which is often cited as an economic reason as well. So that's something to note. I think that has to do with the proportion of people in terms of the gender identifying demographics. Black African Americans are 6 times overrepresented. In the county at large, it's 5 times. So, and American and Indigenous folks are 10 times overrepresented. And I will say, in general, there's a larger proportion of the population here that identifies as American Indian or Indigenous than in the county broadly. So that's something to really focus on too. And this is just one that often really tracks with what we see as a need in our system and throughout the rest of the county. 76% of the folks that were counted reported that that episode of homelessness, at the time of which we engage with them, had already been a year or more, right? So because of the lack of resources, folks are staying homeless for longer, and that is the problem of our system. Homelessness is bad for your health. It's bad for getting your needs met, and so folks have a harder and harder time the longer they wait. So that's our call, and that's our need, is to respond with a better system, with a more equitably oriented system, and increasing our investments. So thank you all for committing to do that to all of the local, state, and federal government people you have connections with. That's it. I think we're going. So now we are going to be moderators, of which we both have advanced using. Our esteemed panelists, that especially locally. Yeah, can we do that? Can we do a quick round of introductions of you for the group here? If we want to go down the line.
Hello everyone, my name is Susan Houghton and I am the founder of Sunflower Hill. We develop affordable housing communities in the Tri-Valley, and I have a wonderful garden in the city of Livermore, Heckenman.
I'm Lanning Thompson. I'm the Vice President of the Board of Interfaith Housing, which has 3 senior apartment communities for low-income seniors in Livermore, and we're working to build a 4th.
My name is Christine Beach-Lamani. I'm the CEO of City Serve of the Tri-Valley, and we serve those that are low to no income with wraparound care coordination, primarily in the Tri-Valley and a little bit throughout Alameda County.
My name is John Boss. I'm the Executive Director of Open Our Kitchen. We do food insecurity. We operate the new Vineyard Resource Center, laundry, showers, mailboxes, care coordination, case management, food. We do pop-up pantries in the Tri-Valley. We do senior meal programs. We do street outreach. Yeah, so.
My name is Sharon Lamini. I'm the Director of Domestic Violence Services at Tri-Valley Haven. Tri-Valley Haven has operated a domestic violence shelter since 1977. We have an emergency domestic violence shelter, a 2-year transitional housing program, a homeless shelter. We also have 3 housing assistance programs. We have a counseling department, we have legal assistance, food pantry, and thrift store. So those are our services. Thank you.
Good morning. I'm Kim Curtis. I am the Executive Director of Goodness Village, which is the tiny home community for our formerly unsheltered neighbors within the Tri-Valley. We take in the folks that are HUD defined as chronically homeless, which means that they have a long history of being unsheltered and have either a physical chronic illness or a long history of severe persistent mental health disorders. So we provide 24-hour mental health support in order to keep them in the least restrictive environment possible.
It's very obvious why you all are here. This is an exciting discussion. So I'll take the first question, and then we can go back and forth. We've done this. We do this all the time. We're a traveling show. This is a question for everyone. If you could briefly name the top 3 challenges faced by the vulnerable populations you serve when it comes to securing affordable and stable housing in the Tri-Valley. Part B, in what ways are needs similar to those you serve? I don't know if that's important. It's back. The first part. It's for everyone, so we can start down the line.
I'll just start. Thank you. So Sunflower Hill focuses on intellectual and developmental disabilities. That is our sector that we're focusing on. And I think for the 3 challenges that we see as an organization is, first of all, I think people are very unaware about the number of people who actually have intellectual and developmental disabilities in the state of California. I looked up a quick stat before I came here just to kind of give you some perspective. 39 million residents in California, that's the total number of residents. Approximately 1.6%, or 625,000, have some form of intellectual and developmental disabilities. Now those are spectrums, so you can see some very high functioning folks, but you can also see some severe and moderate folks with intellectual and developmental delays. Regional Center clients. Regional Center is the support services agency that helps here in Contra Costa and Alameda counties. They have approximately 28,000 folks on their caseload. In the state of California, there are 300,000 people who are part of Regional Center of East Bay. So for us, defining and having people understand that this is a population that we consider on the verge of homelessness is very important and very much in need of housing. The second thing, just very quickly, is that we are at below $15,000 for our residents in annual income. Most of our residents at Irby Ranch, our 31 unit development in Pleasanton, only get Social Security or SSDI. My own son, he gets $1,200 a month from Social Security. His rent is $1,100 a month. So there is very much a paradigm that we must do as an organization to help raise the awareness that we are also the face of the need of homelessness, the predisposition, and affordable housing.
The vulnerable people we serve are low-income seniors. Even if seniors did have a job and adequate housing, when they retire, they may not be able to remain in their current homes on their limited Social Security income. They may not be able to find any other housing they can afford. And they can't apply for subsidized housing in this area because most of the waiting lists, like those at Interfaith Housing's 3 apartment communities, are closed indefinitely. So there are not a lot of options for them.
Right, I would agree with that. The 3 challenges we face, we're working with the folks that are below 50 AMI, low to no income. So I would say 1 is inventory. That's a huge obstacle, especially those, they want to live and find homes here, not, many miles away. So very local, affordable, sustainable, and dignified housing. The second thing is waiting. The lists are so long or not even open. That leads to an apathy. It leads to a loss of hope. So we see that as a huge challenge. The last thing is applying. And it's an obstacle. What is this maze? How do we apply for housing? How do we get technology to go on to apply for that? How do we get assistance with the housing? Where is the housing available? So those are all just really big obstacles for our folks.
Yeah, and a lot of our comments today are ditto, right? This is the challenge. This as a given, that notwithstanding what my esteemed colleagues have said, I think capitalism is the challenge. Homelessness is a market failure of capitalism, and capitalism does not know how to solve it. Apart from that, I can only speak from my sort of experience with folks. I'm making about $1.13 an hour right now in this job, so training new shelter coordinators and all of that, and just being in those awake hours with folks and meeting with people. For me, the human piece of this, the biggest challenge that I see folks facing, that I interact with on a daily basis, is just disconnection. I know that there is no blood test for disconnection to verify it, but it is as real as the table is in front of us and the chairs that we're sitting in. This rupture and fracture that people bring with them in crisis, and the spigot is always on to varying degrees and levels. And yeah, so for me, restoring that sense of humanity sometimes feels like it's just moving pieces around in the Titanic, because we're so conditioned to think about how fast can we get someone rapidly rehoused. Did you make it to the job interview? Did you get the job? All those very tangible, concrete things, but the very intangible pieces of relationship and community and solidarity and purpose and meaning in life. If we're not also doing those things, we sort of undercut and circumvent everything else. So we're all a bit of a construction project. This is not, this is also the case for folks coming to Vineyard, in my experience. And so as we're trying to do all these very tangible things, we also have to do these very humanizing things too, which sometimes gives people back their actual bodies and their selves. And so for me, yeah, capitalism sucks. So.
For us at Tri-Valley Haven, and speaking for my department, which is Domestic Violence Services, we represent a lot of the numbers that you spoke about. Our primary clients are female, though not all the clients that we serve are female. We're working with folks that have been traumatized. And what does trauma look like? Trauma looks like having an abuser not allow you to complete your education, to hold down a job, to hold on to your finances, perhaps turning your kids against you. So we have folks that come into our program with trauma. And so housing is one of those traumas. But they're dealing with low self-esteem, they're dealing with the trauma of having been physically and mentally, emotionally hurt. They're dealing with children that have issues at school. So even if they were to get a job, they may be called away several times because of the child's behavior at the school site. And so for us, helping our clients means healing, helping them to go through the healing process first, before we can take them to the point where we can start talking housing. And that's why we have these programs. We have an emergency shelter that's 105 days. We have a housing program, which is a 2-year program, our transitional housing program. We have a rental and deposit assistance program. We're working with the City of Livermore and the Livermore Housing Authority on the Challenge Grant, with partners like La Familia Counseling Service and CityServe to see how we can get maybe housing units connected to our clients. We're also exploring additional ways, and I hope that this additional way that we're talking about works, so I can come back and talk about that. But the whole thing is, becoming homeless isn't something that just happens. It's not just having low income. It's trauma piled upon trauma, and trauma that we don't often discuss is the affordability of transportation to those folks. We used to have clients about 3 years ago that came in with cars. Today our clients don't come in with cars. I mean, if they had to flee domestic violence, if you have 3 children, you have car seats, you have luggage, you have babies, let's say 3 children under the age of 5, which form of public transportation are you going to take to get to a shelter across the county or within the county? So we're also looking at transportation being a huge hurdle in getting people to safety and in getting people back to work. So we work with all of these. Thank you.
feel like I'm down here on the end as a bobblehead. And I have found my people, and it's really good. So thank you, guys. So the folks that live at the village are between 26 and 80 years old, and they have been unsheltered for between 1 year and up to and over 20 plus years. So our challenges are very much individual, but I will say there's three major ones. The biggest is sometimes our folks who are unsheltered are too ill or have too many things going on for them with their mental health or their physical disability to complete the application process for their disability that they're definitely eligible for, but the hoops are too much for them to get through. And so because they don't have an income, they need to remain unsheltered. And so the longer they're out there, the worse their symptoms get, the additional coping mechanisms that they use to survive are added onto, and thus might make them feel unsafe inside a shelter or make the other folks that live in the shelter feel unsafe. So then they typically become ineligible for that environment as well. And so I just want to keep that in mind. Again, coupling on top of is just this level of distress that is amongst our unsheltered population because of what they've survived through. And so it's not a matter of they don't want housing, it's that maybe they just don't want to ever feel that loss or that hurt again, and to have housing and have it removed from them again, to lose everything they have recouped since their first loss or their third loss. So there's layers that we need to work with as people who are passionate about ending homelessness. And then the third is not maybe meant for the folks in this room, because what I've learned is the people that need to be in the room are never in these rooms, so kudos for you for being here. But I think our third challenge is, as a society, our own misbeliefs and judgments about our chronically unsheltered neighbors. And we want them to be vulnerable, and we want them to take the help that we are giving and offering. But often that comes with our own judgment and our entitled belief that because we are housed, we are better than them and we know what's best for them. And so within that, we disempower and devalue them and carve their identity down to a very simple adjective of homeless, and we brush off that they don't want that help or that they don't maybe deserve of that. And again, in my 20 years of working with the unsheltered population, I've not met a single person that didn't want the safety of a house. But what they didn't want was to be hurt or harmed ever again. And so I just want to encourage us that we ask them what is best for them. How have they survived in the past? What would housing that looks and feels safe look like for them? And just be in the space of, how can I help today? And what do you need now from me?
Thank you guys so much. It's really amazing to hear, because you guys are working with folks on a day-to-day basis, and there's so much passion in what you've all just said. It just always impacts me so dramatically. I'm a bureaucrat, although I love being called the least bureaucratic bureaucrat people have ever met, but I am still a bureaucrat. I work for a local government, and I am in the role of funding, and I provide the resources that come through our office out to the community, right? Over and over again, what I heard is lack of affordable housing, accessing affordable housing, not being able to find it, and not wanting to be harmed in that process because it is bureaucratic. So I know that's number one. I know that that's the biggest thing. But I think the second thing is money, right? Like, people don't understand the connection and the need for the resources to go and build that housing or that service. So not all of you, but maybe one or two of you could actually speak a little bit about how you receive funding from the cities and counties and state, and what an impact it has, and what kind of scarcity has there been that has been impacting you?
Thank you,
in your
Michelle.
services.
I want to talk about that because, first of all, I think it's important for folks to know how important the A1 bond was to our area. Without the A1 bond, Sunflower Hill at Irving Branch would never have happened. Thanks to Supervisor Niley and the health group, it would not have happened. Without the City of Pleasanton putting additional funding through their housing fund, it would not have happened. And so people don't understand that funding, that private financing and funding, is so hard to access. The multifamily supernova just came out, the rounds, 34 applications in Alameda County alone. These are places like Eden and Saha, Sunflower Hill, trying to put together a proposal to get state tax credits, to get public financing. 34 applications, only 6 were funded. I think you've been on the list for 7 years for one of your projects, correct? A long time.
Well, we've been working for 7 years.
So part of that is that it's not that cities don't want to build housing, they do. It's not that there isn't a path forward. But then you get this project. We have Grace Point that's coming into the city of Dublin right now. We are so excited to be able to build it. It will cost $47 million to build 60 units. That's $800,000 a unit. Ruby Ranch was $22 million, or $600,000 a unit. So we have to then, without a bond, pull together and try to find money to make our application even competitive. Because half of those 34, half of those applications were not even reviewed because the pot of money was so low that they said, we can't, why even do it? So now those people must wait 6 months to try to find another application and try to be able to cobble together, whether it's city money, county money, going to our Congress people, like Goodness Village was able to do several years ago, and get line item funding. I also am a firm believer that this solution is a public-private partnership. We have to call on our corporations, those developers I read today. Google is now putting money towards guaranteed income and being able to house and help homeless people. Wells Fargo has funding for housing. We have to have all of that together because $47 million to house 60 people, it's hard for a nonprofit to try to find and get together that money.
Thank you. Anyone else want to talk about lack of not just affordable housing funding, but funding for your organizations?
I can talk very briefly. Our ED, who's sitting right in front of us, Christine Billman, myself and several of our staff attended a 2-day rally, policy day, in Sacramento, and we went to talk about the potential VOCA cuts that are looming large. So this is, we have a shortfall of about $200 million. And this will impact 400 organizations that are serving vulnerable populations across the state of California. That's between 44 and 50% loss of funding for these agencies. And that will have very serious impact on housing, on mental health, on the, as far as we're concerned, possibly fatality rates for DD survivors. And so we look at this picture and we're horrified, and we're doing everything we can to make sure that this doesn't happen. We're very fortunate at the same time that we decided a few years ago to go into the rebuilding of our existing Shiloh shelter. We're taking it from a 30-bed facility to a 45-bed facility, and we have Mayor Marchand here that I would like to thank for the city of Livermore. We have the 3 cities in Alameda County and our leaders, because we've been able to secure the funding for the most part that we need, and we will be breaking ground soon as far as construction is concerned. But it's an ongoing struggle, knowing that there are cuts down the road. So thank you.
I want to point out that what I said in my presentation really holds true. We all pay taxes. We pay income taxes to the federal and state government. We pay property taxes to the county, and that flows down to education and our school systems, as well as our city infrastructure and our county infrastructure. So our tax dollars are what flows down into creating the funds that support all of these organizations and support the building of affordable housing. And so when I was saying, hey, it is your elected officials, they make those policy decisions. They make the decisions about what program to fund and what program not to fund. And so local advocacy to support domestic violence programs, food security programs, homeless programs, all of you have a voice, and your voice comes out when you go to the ballot, but it also comes out when you send that email or make that phone call. And so I encourage all of you to continue to be advocates for this issue, because it is your tax dollars. And if you break down the federal budget, you will see that the vast majority of our funding, our discretionary funding, is really not going to these kinds of programs.
On my first week on the job, I learned a term that I feel like I can identify with more than bureaucrat, and it's bureauactivist. I'm not sure if folks have heard that term, and I'm like, I feel so seen. I can work for the government for a long time now. But in that spirit, I just want to lift up to your point, Susan, and the public-private partnership, a statistic that sticks in my mind that really helps us understand where we are and where we could be as a society. If corporations paid the same corporate tax rate they paid in 1980, we'd have $68 billion more in our budget and not be in a deficit this year. In 1980, so 1980 rates, so the rates have gone drastically down. Ending homelessness, the most comprehensive study we found in what California needs is about $8.5 billion a year over year, to really bend the curve, which is less than 3% of our state budget. So this is not sort of a where is it, it's what we've given up, right? And we're operating in a world that is less flush, including inflation, than we were in 1980. And I think that's really the point, is we need public-private partnerships because the private is not paying its rightful public share, right? Okay, with that said, in the midst of the cheery world we live in, and I think just saying this as a fellow nonprofit person, maybe this is for folks doing kind of more of the services and the coordination, how do we function and collaborate as best we can in this world of scarcity? And I guess some examples in your own work between the work of Open Heart and Goodness Village and City Serve, the work you do, like where does nonprofit collaboration and coordination in the midst of the dearth of resources we have, where does it show up, and give us some bright spots?
I want to jump in on this right off the bat. Vineyard works because, I mean, I don't take for granted the Tri-Valley, the collaborative nature of the nonprofits. I've worked in nonprofits across the country, and there's something special about the collaboration of the Tri-Valley. Vineyard works to literally wrap around an individual because we have great partners in City Serve on the case management care coordination side. We have great partners in Access Community Health on enrollment and getting folks to the clinics to get those long-term services they need. We have that in Barrier Community Health that as a nurse practitioner, they're on site every Wednesday to triage and to talk with people. We're adding Partners for Change for those longer-term cohorts to walk alongside people for longer periods of time. We do it with Tri-Valley Haven, and we have a domestic violence advocate there to address issues of intimate partner violence, which is on the rise at Vineyard. People come to Vineyard, and we're able to connect them to Tri-Valley Haven if they're not already. So all of those services, really, none of us would claim individual success on moving the needle at all for any single individual. I think what's surprising for most people is the number of touch points it takes for every organization. Margaret Ann had a great write-up that she shared with the city about this, that we were able to get, with partnership with the City Serve and others, a father-son duo permanently housed in San Ramon. And part of that is they had been staying at the Open Heart Refuge overnight shelter for 2 months. They were stabilized, food, the ability to wash their clothes, the ability to wash their bodies, the ability to meet with people who care and love about them, the locatability of them, which is not always so easy for individuals who are on these very, very long wait lists, to just, for City Serve to know at any point in time, this is when these two individuals will be there, let's make sure they're document ready. So all of those pieces have to fall in step and in line in order to move the needle for someone. But it took 5 or 6 organizations at minimum to just move 2 people into this permanent supportive housing next step for them. There may be a better way, I don't know what it is. This is our way. We're too busy on plan A to figure out plan B. But for these 2 individuals who come back once or twice a week to visit the folks that were at the shelter with them because that's their family. They're now housed and they come back to eat, sit down. How's it going? I got a new car. Our apartment's amazing. City Serve's getting us furniture, like just all of these pieces. This is the work, right? I don't know what the work is outside of it, but this is the work, right? I have a friend that says there's no path to, there's no way to peace. Peace is the way. There isn't a way to love. Love is the way. This is the work that we do.
Nice. Thank you very much.
We'll do just one more, and then open it up to questions from the audience. That's about right? Okay. So tell us one thing that has happened to your organization recently that was just a wonderful, amazing thing. What's the wow that has happened for you recently?
Should we go this way?
Yes.
Okay. I just have a little story that I just want to share with you because I think that it helps. We all have a lens that maybe we look through homelessness or a perception of what it means and who those folks are. And I just want to share a story. Early on in the village, we noticed that we had a few folks that at night, despite us having night staff, they felt that they needed to secure the perimeter. We're on 35 acres in Crosswinds, and the village itself is small, but we have a lot of land. And so we would notice them get up in the middle of the night and with their flashlights, and they would go around, and we thought, wow, wouldn't a neighborhood watch be cool? And could we put that into our vocational program that we are having these folks on the clock with our staff? And so 4 of our neighbors took on this role, and every night they're on their shift and they go out aligned with the staff on our hourly security walks. About February, it was time for us to all renew our CPR first aid training, and we thought, wouldn't it be cool if we invited them to join us? Nothing at the village is mandatory. It is all on, I want to be involved in the community feel. So those 4 people took that invitation and they showed up for that day. Despite being up all night for their shift, they showed up in that morning to do the training. And then 2 weeks ago, my support staff got a phone call during their shift from one of our neighbors, and he said, I think I'm having a heart attack. And so my support staff, mental health trained, partnered with one of our formerly unsheltered, over 5 years unsheltered 59-year-old male. They grabbed the flashlights, the AED bag, the first aid kit, and they were at the doorstep. And this person was able to get his medical care. He's back at the village, he's thriving, he's fine. But I don't think we often think that that's the response that our unsheltered individuals would have, and that they would care and love about their neighbors and show up in that way and be prepared, and that we could rely on them to be our partners in a crisis response in that way. So I just really want to wow factor you as well.
I think for us, it's been, it's knowing that during the process of moving out of a shelter that was in operation since 1977, we have continued our services uninterrupted. We were able to relocate clients. We were able to secure funding. We're looking ahead at how much more we can offer. We're developing programs. I know I spoke about potential funding cuts, but we're determined to do more on whatever we have, regardless, and continue to build those partnerships that will sustain our clients and us into the future. Thank you.
We had a case where an abuser had filed a missing persons report on his spouse of 35 years that he had kicked out after slamming a glass against her face, who came for a meal, and someone recognized a picture of her and shared it with me, and I had a chance to talk with her. And long story short, we were able to get the officer who had been assigned to the case to come out to take a report from her. She had already gotten connected to Tri-Valley Haven, was able to talk to Christine because she was, with all the things going on in her life, she was very much worried about missing curfew at Tri-Valley Haven. So Christine so wonderfully, lovingly on the speakerphone said, we got you, we got you. We were able to reconnect her that day with her adult children who did not know she was alive or dead and had come a couple hours away. And then they came out to Vineyard, spent 2 hours reconnecting after a couple of years in the conference room that's there. And then she's safe, she's okay. So just all of these pieces that are just working together in that moment to, you know, to have a story that ends well, because they don't always end well, right? So.
I've only been in this area for 4 years. I did most of my work out in the Fremont Tri-City area, and so when I came out here, it's shockingly very different, and the homeless population was very different. So we were starting to see the trending that you guys have the data behind of the older adults that are out on the street, and I was like, this is so unique. I'm used to the 30 and 40-year-olds. And so we as an organization were going, how do we start to address this? And then the WOW is an organization came and literally dropped in our lap and said, we don't have leadership, we would love to merge with you and take on, and they had a ton of just supportive and preventative services for older adults. And so it really complemented the work that we're doing. It helped us to expand. And so the WOW also, as we made it through the pandemic, we were both kind of weaker organizations, and together we became stronger, and we actually expanded through the pandemic. So that was a big wow and shocking for me.
Yay.
It takes so long and so much money to build new affordable housing, and you have to assemble many layers of funding. We've been working to build our new project at the end of Pacific Avenue for 7 years, as you mentioned. And we were going to apply for the last, it will cost about $54 million. We were going to apply for the last chunk we need, which was about a $22 million tax credit thing at the cycle in January and February, but they didn't have enough money they didn't have that kind of money, so we didn't even apply, and we're trying again for a different cycle of 4%. So there are many different sources that you have to collect from. However, as our speakers have said, there's funding for construction, but not for continuing operating costs. And the subsidies that we may or may not get aren't really enough. You get more funding if you're serving more vulnerable people, but they can pay less in rent. So it's very hard to stay in the black. But our WOW thing, Interfaith Housing was awarded a $7 million HUD mortgage with subsidies for 36 of our 78 apartments. And for our Pacific Avenue project. We were among 25 projects in the nation and only 2 in California that received this funding.
It's a great wow. All of these are hard to follow. I think as I listen to all the organization representatives here today, you realize it really takes a village, and that I'm just the founder. I don't do the day-to-day stuff at our organization, and my wow is our staff, and especially at our garden. If you've been out to Sunflower Hill Garden at Hageman Ranch in Livermore, we bring out individuals every day from day programs and from high school classrooms that are IDD. And our staff, they get more joy out of being with them than anything else. So to listen to our staff talk about the people, what happened that day, the very best tomatoes this side of the East Bay, and that is the gratitude moment. It's a gratitude moment that we're doing the right thing. And that together, when we all join, when we give our produce to Goodness Village and to Open Heart Kitchen and to Culinary Angels and Tri-Valley Haven, it's us giving back to the community, because together we can all do great things.
Well, I have some questions here, and I'm going to go ahead and start them. We've got quite a few, and so the first one is going to be to Michelle and Jonathan. And so a significant barrier for so many experiencing homelessness is the, I think, lack of focus on animals. Can we start? Okay, I'm having a hard time reading this. I think this is you.
Melanie gave us that.
You want to ask it?
I'm an animal person. and I want to suggest that it's even close to the scope of the issue, but it is a barrier. And so we have so many people
So,
I just want to ask if that is something that you guys have considered.
Yeah, I can speak a bit to that. I think it's very important, true, as an interspecies household, that my family members are my animals. And I think that, I mean, obviously there's tons of data that shows that folks that are unhoused or at risk of homelessness have just as intimate relationships and often are sacrificing their own care to care for their pets. And so when we don't create environments to support people that are inclusive of pets, I mean, one of the things we talk about is, you know, there's the 3 Ps of development, and then there's the 3 Ps of low barrier shelter, which is pets, partners, and possessions, right? We have to create environments, and we have to, I always say this as I'm putting on my former shelter operator hat again, like, we have to create environments, and shelters need to do this, but they need to be funded and supported in a way that allows them to do that well, right? And so I think that that's the first thing, is there are programs in Alameda County, not as many as we'd like, that are funded and structured and designed to be pet-inclusive environments. I used to work at VAX and have lots of navigation centers and stuff, and we joke, because it's true, like, they're interspecies shelters, right? Like, we've got cockatiels you know, and dogs and all the rest. And so that's one element, I think, that there is increasing advocacy and inclusive understanding that that's baseline for what we call like low barrier standards for shelter, but developing systems that are supported in a way and staffed in a way and physically infrastructured in a way to do that well for people is, it's a lift, right? And it's culture change, especially for some organizations.
But can you start tracking?
Tracking, right.
During your point of time, when you're going out, is there a way to start tracking?
Yeah, I mean, I think we can in HMIS. I mean, that's a really good point. HMIS is our kind of data system for like the system-wide, much more, frankly, better. Some of the data I was pulling was from that. That's our like year over year, every day getting data on folks. I think that's a really important point. I mean, everyone that works in this work has the anecdotal data of like, it's a big percentage of the population, but yeah, I'm going to get back to you on that. I think that we very much can in a pretty simple way from a system level.
all right, thank you. So, and what can the county and cities do to streamline affordable housing?
Well, there's a lot that's happening right now to streamline affordable housing, but the number one barrier right now is lack of funding. So Measure A1 was the $580 million that we passed as the county in 2016, and all of those funds have been spoken for, essentially. So there's no new pot of money. And as the state is grappling with its budget, we're also grappling with ours. And streamlining affordable housing is reducing all of those different applications that we've just talked about, the 7 or 8 or 14 different funding sources. In order for affordable housing to be easy, we don't want developers to take 5 years to apply year over year over year over year for different funding and knit it all together over time. We want to be able to fund it in one fell swoop. And so that's really what needs to happen at the local level: one application, one funding source, one award. At the state, one application, one funding source, one award. And there's a lot of advocacy around that right now. Just as an aside, the 4% bond program used to be that. You used to be able to knit together your local sources, and then you automatically got the 4% bond funds because there was always enough. But there hasn't been enough for about 5 years. So recently, there's been some changes at the federal level that could allow us to have more tax credits, and that might also help next calendar year. Or I guess maybe it starts in July. So it's a new federal policy is going into place. It's a new tax policy that will hopefully loosen up some of those things so that we can get back to the automatic funding with the 4% bonds.
Kathy, can I add just something to that really fast? I think there's 3 things in addition to what you said, Michelle, that cities and counties can do. One, look at fees, full impact fees, inclusionary housing fees, all of the fees that are tacked on for typical developments, can those be waived? Number 2, increasing the number of HUD vouchers or project-based vouchers or county vouchers. Livermore has its own housing authority. They can assign project-based vouchers. It's fabulous. Dublin and Pleasanton do not. So they've got to compete with the county housing voucher opportunities, or if you're lucky, you have an individual voucher that's assigned to you, a HUD age 11 voucher, that if you get on at birth, you might be lucky to get it by age 60. So that housing voucher program has got to increase. Third, give cities control over the projects that are coming through the tax credit application process. Because of those 34, there was only one local one in Dublin that was funded. The others were in Berkeley and the other in Fremont, those 6 that I were talking about. I personally believe that because the cities understand the needs, that they can help make the decisions, the right decisions, to fund the projects. And if we had voice in Sacramento on those committees helping to say, these are the priorities for our region, we'd see a lot more projects funded.
So one of the challenges to building more affordable housing in the suburbs is that people don't want it built near them. How do we address that?
Maybe the flip side of take away local control. Sorry, just kidding. But I mean, that's a very real factor, right? In the way, in like the sort of ideologies in our communities that tend to blame the people we've deprived for their deprivation, right? Which is what we've done, and which is why we have homelessness. I mean, I think that that's a very real question, right? I mean, I'm not going to get to, as a person that spent a lot of their life and now spends it in a different chair, at the supervisor and the council meetings and the places that used to then go say, yeah, we're the ones doing the project, we're building the shelter in your neighborhood or trying to build this housing, and then, you know, experience the heat. We have this sort of myth as a society that somehow this like local control, everyone's speaking like is right and it's democratic. It's not. The people that have the time and the resource and the power to show up at that council meeting and communicate and push back are not representative of everyone in our communities, right? They're the ones with the time and the power and the resource, the privilege to do so. So we have to find better ways to create the space that isn't just those who can show up and sort of decry the project because they mistakenly think that that somehow is harming their community. You know, it should be very counterintuitive that bringing resources to folks that need it, the thought that that makes us think our communities are going to get worse versus solve problems, right? It's like, we don't have grocery stores. We better not put grocery stores here or all those people that need food are going to come from far around and make our community worse, right? It's very counterintuitive that services actually reduce impact in neighborhoods, and so some of that is messaging, but it's also empowering people to come speak for their needs and raise their voices at these council contexts that we know are not equitable in terms of accessing it, because not everyone can come at 4 p.m. on Thursday unless they've got all the resource and power to make their voice known.
Right. Thank you.
I want to add one more thing, which is a little bit bigger picture. California has been growing for the last 50 years, and our population has really gone through the roof. We are the most populous state in the United States. And what we remember from 50 years ago and what we are nostalgic about is the suburban single-family home. We all wanted a suburban single-family home growing up. We wanted a front yard, we wanted a backyard, we wanted a tree with a swing, and we wanted a white picket fence. But our population is beyond that now. We have to acknowledge that the development pattern of the past is not going to be the development pattern of the future. Single-family homes are being built in smaller and smaller percentages of the development cases that are happening. And apartment complexes or condominium complexes, however you want to look at it, multifamily large buildings is what is being built right now. And there's a knee-jerk reaction to those apartment complexes. We don't want apartment complexes. That's too much population, that's too much density. But in reality, we are either going to build in our urban centers and our suburban centers high-density housing, or we're going to build on our farmland. And as we think about our state and our nation, can we really afford to build on our farmland? Do we really want single-family homes instead of farmland? Do we really want people commuting from 4 hours away or 3 hours away to get to where the jobs are? Or do we want to acknowledge that multifamily housing is here to stay and we need it? It's not just for low-income folks. There's plenty of luxury, multifamily housing that's going up everywhere. And we can no longer be nostalgic for that single-family home dream of the 1950s, because our population can't support that anymore.
I wanted to add something to it. You know, I'm glad you brought up, you talked about back in the day, you brought up Tennessee. And I live in Tracy, I work in Livermore. I can afford to own a home in Tracy. I can't afford to own a home in Livermore. But when I look at my clients, you don't have transport. There was a point in time where all of our agencies were finding it hard to hire folks to work at our agencies. And transportation played a huge key. And I think it's time we looked at why, you know, I come from India, we have a similar problem. And the problem is we have urban density occurring where there are jobs, and then we have 97% of the country that lives in villages that doesn't have jobs, and then COVID happened. And when COVID happened, we were worse impacted, but also we suddenly saw a lockdown and we saw people moving into homes and the cities were empty. And I think we really need to look at why aren't we creating jobs where people are housed, and and that would also eventually make houses more affordable, because if everybody's coming to jobs to Alameda County, that's driving up the cost of living in Alameda County. And you know, it's going to impact us ecologically as well, because we're going to see a drop at the water table, we're going to see everything else happen. Fires will impact us worse because we are living in greater density. And I think there needs to be something from the top, and unfortunately I don't have the expertise or knowledge, but I really want to know why we don't have that happening. Thank you. Yes.
If I could just make one more point on this, which I think ties in, is when we, like, suburban neighborhoods are extremely inefficient from an environmental perspective, right? And not, high density housing is greener and more economical, right? That is also an issue that people can get behind, right? There's a smaller and smaller percentage of people that have in climate denial, at least in a lot of our communities. And this is a further point of people getting pushed out that is so critical, that housing justice is economic justice, is environmental justice, because the more people that are having to commute far distances in as they're pushed out, all of it is affecting climate. So the interlocking nature of those around the kinds of development we do very much connects with like global planetary issues, right? It's not an isolated thing, it's about the whole intersection of these issues.
Yes, I think all of us the one sitting at this table has been at the sharp end of the stick of public opinion on the projects we're doing, whether it's Kim at Goodness Village and or it's Asbury Methodist Church attempting to do a Goodness Village project there, which the neighbors say they love the idea of housing people, just can we do it at Goodness Village where we don't have to see them? So I think now that we've commodified basic human rights like food, clothing, and shelter, and this is where we are at this point in time, we have to take stands. We're not going to sit around the campfire and sing Jimmy Buffett songs and braid each other's hair over these things. But I think we're making value judgments as cities and counties, as nonprofits, to say, I would rather have you, whose house to make a lot of money and drive a Tesla, be pissed off at me, than the person who doesn't have the most basic human rights met. I side with them. We don't have to be friends, but we owe it to this person to guarantee those basic human rights. You may think that people should have to deserve things like food, clothing, and shelter. I don't. And so this notion of we just want people to go away, well, even when we throw our trash away, away is somewhere. So at some point in time, I just call BS. Like, you can't say you want this and then you're not willing to have some skin in the game to do it. So I call it bullshit, right? Like, this is where we are. And yeah, can we reach some consensus? Can we democratize this? Let's do it. Let's play nice, but at the end of the day, if people are getting housed and they're fed and they have clothes on their backs, I can look myself in the mirror at the end of the night, knowing that I sided with that person, and I may not be best friends with the person that takes issue with that. I'm okay with that.
Yeah.
And that is, I want them to just go away, right? Remember I was talking about the nationwide housing crisis? I was talking to you about the out of reach report, and that was the first slide I showed, and I really highly encourage everyone to look at that report regularly. Anyways, in 2021, for the first time in the nation's history, there was not a single state in the nation where a minimum wage job could afford a 2-bedroom rent. There used to be the ability to say, well, let's just send them to Georgia. Georgia is now out of reach, okay? There is nowhere in the nation where your state average minimum wage pays your state average rent. Now, there might be some isolated counties within certain states where you can actually afford at minimum wage a 2-bedroom apartment, but there used to be whole swaths of the United States where that was possible, and it is no longer possible. So we are no longer in a place where we can say to people, well, just go live over there, because over there doesn't exist. And I really wanted to drive that home, because I have heard people say, well, just have them move to Sacramento, or have them move, sorry, Sacramento's out of reach too.
So I'm going to ask Jonathan one more question to end this on. Would you like just wish I could give you maybe like a minute or two to answer it? Yeah. And then we'll wrap it up. So can you talk about the potential impact of the Grants Pass versus Johnson care or case before the Supreme Court? If the Supreme Court decides to criminalize homelessness, what can happen?
Yes, I can. You know, I think it's important, and I'm feeling the activist more than the bureaucratic side of me, just based on all the wonderful things people are saying right now. But I think it's important for us to realize, one, no data in no part of the world, in no corner of this country shows that that will be helpful, right? From just a pure brass tacks, not even being a human, which is why we should start this conversation. So it will not be helpful, right? It will empower communities to do things that even in the best of intentions that they think will be helpful will not, it will just exacerbate this issue. But much more importantly than that, even if there was an argument that this might help cities be what people want, which is people out of their parks, off their beaches, all these things, which is really what's driving this, not wanting to solve the problem. If you were to come from outer space and land in this country, come to the United States, see hundreds of thousands of people living without housing, read the ever-recurring reports of how unlivable our economy is for folks on lower incomes and let alone fixed incomes, and then go to the highest court in the land and see what it's choosing to debate about, which is whether local governments can criminalize, fine, and fee people out of living in their communities, you couldn't really determine anything less than we're nearly religiously committed to blaming people that we've deprived for their deprivation. And so I think a lot of this is, as human beings, like, we have to see this for what it is and use our voices, to John's point, to speak to the truth of the data, but also speak as human beings, right? Which is the reality, the fact that there's no county that anybody can live in on a minimum wage, and this is what we're talking about, right, at the federal level. Context is everything that matters in this moment, right? And so that is the truth, I think, that needs to come out, right, in these hearings and in these communities. It very likely will pass, it seems, based on the makeup of the court. And so it's going to become local governments and cities and communities having the ethical and human standards to stand for what we know solves this, right? And to speak that truth and to care for our neighbors, right? And so that the local application of this is going to become the name of the game. And I'm happy to be in a community where I think we have the moral fiber to at least push and be willing to not be friends with folks who might want otherwise. And but that's where it's going to go.
Thank you for that. So I will tell you, we had a lot more questions that we didn't even touch on, and this conversation could go on for a long time, and I think we need to create an environment where that can happen. I do want to thank all of you for coming today, for participating in our panel, both from the county and our local cities, for showing up for this and having this conversation, and all of you for being here as well. So, all that said, again, I want to thank our amazing panel for coming out today.